Now that you've learned more about hip hinging, it's important to figure out how to integrate that movement pattern into common daily activities like getting up and down out of a chair or putting weight on your back and squatting it in the gym. So let's take a look now at how to develop a better squat pattern. Frequently, people who have back pain have problems bending down and picking things up off of the floor or just squatting down because they have inappropriate movements happening in their spine. For instance, we don't want the back to round when we try to pick something up. And one way to train better movement strategies to get things off of the floor is through the box squat. To do this, you'll need something about chair height, and you're going to stand pretty close to that chair. Take your hands and put them out in front of you, and keeping your chest upright and your head upright, stick your butt back behind you as if you're going to sit down. Squat until your tush just touches the chair, and then come back up. Again, we're focusing on the first movement being the hips going back rather than the knees going forward. Your weight should be mostly back on your heels as you're doing this. Many people inadvertently, when they try to squat down, have developed a pattern that is mostly dominant here in the thigh muscles. And when they do that movement, that inappropriate movement, they'll shift their weight forwards and their knees will bend forwards first as they try to get something off of the ground. That's not a good strategy, because if it doesn't cause back pain in that individual, eventually it will cause knee pain. So instead, we want to shift that first movement to the hips going backwards. Backwards as if you're going to sit down. And we'll counterbalance here as we do this corrective exercise by putting the hands out front. Notice as well that in this position, when I'm down here, my knees are over my feet, not well ahead of my feet. This is poor form. This, however, you have your weight on your heels and it's where you want to be. Now, rather than just sitting and resting, you want to come down and just barely touch the chair and then come up. You can do repetitions of this just to teach yourself this new way of moving, focusing on keeping this protective curve in place in your back as you go up and down. This is very helpful for people who have disc injuries and who have difficulty getting up and down out of a sitting position in a chair. Now let's take a look at that movement from the front. Again, the chair is relatively close to the back of your knees, and you want to counterbalance by placing your hands out, and as you squat, your butt goes back first, not your knees forward, and your weight is on your heels. Also, something to take note of, your knee position should be pushing out, almost as if you're trying to pull the floor apart with your feet. Let your knees go out, not in. It's not okay for your knees to drift inwards like this. They should be pushed out strongly. That will help to activate muscles in the hip and the gluteal muscles. That will help to give you good spine sparing strategies to get things off of the floor later if you need to.